that are created by the pandemic. However, they're not necessarily perhaps placing that blame at the right place. And so, I'm going to get into that a little bit, but I just want to preface this by saying I may make some people angry today. I may say some things that some people don't agree with. And I had to come to the realization from a public health perspective that the only way for us to speak the truth, the only way for us to continue to push forward in a positive light is to also try to combat misinformation. It is also to try to speak up to those political powers who may be using this for their own benefit and not necessarily for greater society from a public health perspective. And I want you to hear that. I want you to hear my anger. I want you to hear my frustration, because that is shared anger and frustration amongst pretty much every single public health person I talk to. And across the board, we're going to talk about some specific emotion that I continually hear from frontline healthcare workers, and that's all. It's all of us who are trying to take care of people and move things forward. So what have we been doing? What has our team done? So we basically are a management team that has come together within the Stratford County and Seacoast Public Health networks. We've at times had as many as 24 personnel in just management roles. We've had over 1,000 volunteers. We have multiple municipal, private, nonprofit subcontractors who are also have been doing work for the regions and and on behalf of the state at times. Sometimes directly through us, sometimes directly to the state. I mean, so everyone's kind of really stretched and doing all that they can here in the last few years. Where we focused on, initially during the stay at home, we had a lot of concerns as far as, and if you've heard me talk, I've said this before, we focused in on making sure that services for the people who need those services every single day prior to the pandemic continued. And that was our biggest thing, is we wanted to make sure we could continue essential public health services. So making sure people had food, making sure there was transportation, housing, health access. So that was kind of our initial focus. And then, flashback to a year ago now, we're rolling in, hot and heavy on the vaccines. Initially, for us as a regional perspective, we were just focusing in on the nursing homes. We wanted to make sure they all were completed, and the assistant care facilities, while the fixed site was really working towards our first responders, and the hospitals were taking care of their own healthcare workers. And then we did some other, non-health hospital healthcare workers as well. And then we moved in, we had the adults, right? And we were dealing with the adults, we wrapped through them. Then we went to the kids. We were doing these massive clinics over here in the Seacoast, I call it the Greater Seacoast area, Greater Seacoast region, not to be confused with, Goodwin's parent organization of Greater Seacoast Community Health. But in this Greater Seacoast area, we performed significant amount of vaccines above and beyond what all the other regions did, as a lot of people really looked for the state to take that over. We really embraced it and moved forward. Equity and access. We want to make sure we were getting vaccines out to disenfranchised populations that generally have access issues, populations that we were seeing extreme disease in, and taking so we're looking at our people, persons of color. We were looking at different ethnicities. We were looking at the LGBT. It was any group that we could think to try to get into, to try to get this access. And then we're also looking at people who generally have a normal difficulty with access, certainly our transient populations, and also our substance misuse populations, right? So then fast forward, what we also, during this entire time, what we have continued to try to do is provide a situational analysis to different stakeholders, whether it be schools. Sometimes we've tried to appeal to the general population, and then ultimately community leaders. And that's really kind of evolved over time. And some of it also with our own security, as far as our knowledge and understanding what's occurring, and being willing and able to speak in terms and in a manner that is maybe not what you're hearing from governmental agencies because of various reasons. So I've really tried to stick to, this is public health. These are what the public health experts across our country are saying. These are what our epidemiologists are saying. These are what our physicians are seeing. What I really hope is that the ability to kind of understand the medical system, understand clinical care, and then also, have evolved in a public health knowledge, that those things kind of came together, mixed with long-term incident, large-scale emergency management, and so those are the things that we do. But a lot of times this is what it feels like we do. It feels like we're just carrying the weight of COVID, and that's true for public health workers. It's true for healthcare workers as well. It doesn't matter what side of the aisle someone may be on as far as how they're feeling about what's occurring in our healthcare system. But then we also, depending on which side you're of the aisle, the political aisle you sit on, it may be a difference of how you think we should be moving forward and getting out of that. That's no secret to anyone. But I would say probably for the bulk of us, certainly in public health, and for pretty much most in healthcare, it kind of feels like we're swimming upstream against a lot of our friends and neighbors and family members. And, you think about what that strain creates in our mental health, because maybe there's some support systems that we had that they aren't there anymore. And people are having to develop different systems that they didn't have previously. So, we certainly have to acknowledge that minimally. Our present situation in New Hampshire, 56% of the population is fully vaccinated in New Hampshire. I want you to remember that number, 56% for New Hampshire. Fully vaccinated. I haven't even got into boosters yet. And I'm not going to provide any data on boosters today. But the point is to remember that, right now, Omicron, that we're seeing that truthfully, you do need to have that additional booster. Maybe if you've recently completed a vaccination, great. But for the most part, we know statistically you have to have that booster to really have some added layers of protection. Currently in the state, we have about 10% of our beds that are still available. That was not true a month ago. That was not true leading up to Christmas. It was we were maxed out. And we'll talk about that just a little bit more as I get into more of our regional beds. And we have about 8% of our ICU beds are available. Candidly, that's not a horrible number in normal circumstances. That's, hospitals like to run it tight. They want those beds filled. I mean, it's about profit margin too, right? We have to take that in consideration. It doesn't matter whether it's for-profit, non-for-profit. It's all a business. And we can't forget about that. But here's what we forget about a lot. This is in New Hampshire. We have over 870,000 deaths in the United States. We have 2,145 people who have died in New Hampshire, and that was before yesterday's numbers came out. I don't know how to put that in terms pre-pandemic. Right now, it doesn't feel like, I don't know if we feel these deaths. And I just want you to think about that for a second. I want you to think about over 2,000 residents of New Hampshire that have perished. And if that was to occur at any other time in our modern history from a single disease, entity, anything that was new to us, and how we would be feeling and approaching that. And then I want you to ask yourself, how do you feel today towards that? Do you even think about it? How often do you think about it? And we've lost sight of the human side of this. And in that, unless you're seeing it and experiencing it every single day. So I remember I said we were 56% vaccinated in New Hampshire. I just want to compare two states. This is, leading right up to Christmas. You can see December 20th statistics. States with similar populations. We got Indiana, Massachusetts. Their COVID numbers, their cases on a daily average, pretty similar. But then when we look at the hospitalizations, when you look at the Indiana, it's down in the lower to mid 50%, kind of close to where we are. Their hospitalizations are double what Massachusetts is. Look at their deaths on a daily basis at that point. Double what Massachusetts was. Similar populations in size. Everything's, so what's the difference? Why are these two states so drastically different? And I don't know how to talk about this without saying that politics are killing people. We can sit there all we want, and I have a ton of criticisms that I could weigh in on the Biden administration. I'm disappointed in the Biden administration for some different reasons in their logistical rollouts and perhaps how some of the messaging has come about. And I would dare say that most people in public health have been disappointed in what we hoped would be a more robust response. That said, I have to remind myself where we were prior to the Biden administration. We had basically been given no money to do vaccinations. And mitigation efforts were virtually non-existent. We were downplaying the virus. It's the whole thing of, if you don't test, it's not there. And and if that's what you think, or if that's a theory that works, is that, hey, if you're testing for it, you're looking for it, I would say, okay, go have a lot of sex with a lot of different people, and don't test for STDs. Let's just stop testing for STDs. And when you say that, it sounds absurd, but that's essentially what was being said. So I have to remember where we were versus where we are sometimes to put that in perspective. I want you to look at this graph over here. This is in populations of what you see with the 80% plus number, is in populations that over 80% of that specific geographical population voted Republican in the presidential race. And you can see how this comes about. But then what you're seeing on these are the death rates associated with that. Holy cow. I mean, there's no better picture that politics are killing people. It's this right here. Because what you end up with is red states, blue states. And I would say that we've been pretty fortunate in New Hampshire with our current leadership. In some sense, I almost think we've been lucky. And there are different reasons for it. But I remember prior to Omicron and prior to Delta, sitting there going, if we continue to live as we are, if we continue to choose not to do some of the easier things, not the hard things. I'm not talking about staying at home. And no one's talking about staying at home. No one's talked about staying at home for a long time. Very easy, simple things that we can prevent a lot of death. And if we don't, eventually New Hampshire's luck is going to run out. And it did with Delta. And you can only have, it's a risk matrix. You can only do risky behavior so many times before something's going to catch up with you, right? So, really think about this pandemic mitigation as harm reduction strategies. And we've tried to do that. I've listened to a lot of harm reduction experts over the last 2 years. I've learned a lot. And I'm sure that everything about this conversation that I'm having right now is probably not necessarily always conducive to harm reduction approaches, but I'm having a blunt conversation as far as I'm concerned with a lot of providers and a lot of practitioners and a lot of people who care about other people. And even if you don't agree with what I'm saying, just try to take in some appreciation for how politics has not just divided us, but statistically, we can just see it. It's killing us. It's killing people. So, and I think that's meant that we've all in public health had to find our voice and be willing to speak out and be willing to take a risk and be willing to be criticized and also be willing to put ourselves out there when maybe sometimes we could be wrong. That's the thing with a pandemic. You can't always predict what's going to occur 100%. If anyone says they know what's going to happen, you should stop listening to them. Now, I can tell you what's likely to happen, but I don't know what's going to happen. And sometimes when you put yourself out there and something doesn't go as you thought it would, that's scary. Likewise, when sometimes people control your funding and different things, you wait for retribution. That's scary. I don't even know if this thing's being recorded, and I'm to the point that I don't care, because it's the only way that I can get through every single day, is knowing that I'm out there advocating and speaking for a lot of people who can't. And if our policy leaders are ignoring this or not providing different policies to try to reduce the amount of death and illness, that it's just simply negligent. And absent leadership right now is, in some sense, almost worse than the leaderships who are actively working against public health. So, it's time for us to really have some hard conversations with different people in our lives, whether it be publicly or privately. So right now, what we're looking at is in Stratford County, we have 2,462 per 100,000 in the last 14 days. You know what? And sorry, that actually should have probably been on a rolling. A high, when I write high is 50, that's on a 7-day. But I don't think it really matters at this point when we look at where we are versus where we were. I mean, these are the conversations that we were having back in August about, the high being 50 in a 7-day. Our positivity rate, high is 10. I remember sitting there going, when we were at like 6, going, guys, we got to stop this because this is going to get bad. And that was, probably October. But you could see it continuing to rise up and up and up. We're currently at a 16.4% last week on last percent positivity, and I guarantee you the reality is it's more like 40. It was more like 40 some. No doubt, because we now have people doing antigen tests at home, not reporting them. Like you can see how all this was playing out. At the peak, we were having 3,500 cases a day when we hit peak. Now we're coming back down off that Omicron peak, and thank goodness it was a fast one, and we'll talk about that a little bit. But remember, a peak means you're only halfway through a surge. Remember, the wave is the surge. The whole thing is a surge. A surge builds, right? We're not at baseline. We want to get back to baseline. And looking at models elsewhere, not everyone's necessarily getting back to complete baseline with Omicron, but at least it's coming down. But remember, when you hit that peak, you're only halfway through. So we're coming down, and we're coming down fast. Thank goodness that trend continues. We're currently in Stratford County, we have 2% of our beds available. And this is good. This is better than we were over the weekend. Over the weekend, we were over capacity. In fact, you could see as the Omicron surge was kind of hitting the peak, what you actually saw was not that we had a lot more hospitalizations than what we have today. As coming down, we had healthcare providers out. You saw the beds disappear because what you have to assume from lack of staffing. However, remember that Typically, our hospitalizations start really coming about 2 weeks after the hit. So we always have the peak of cases, and then our hospitalization peak is 2 to 3 weeks behind, and then our death peak comes. So for those who have said, hey, Omicron is mild, maybe on an individual basis for certain individuals, for a percentage of the population, absolutely true. I want you to imagine if Omicron had struck us and we didn't have a vaccine yet, how much worse off we would be. So we are thankful for that. I'm thankful for that Omicron vaccine, that our vaccine was able to really stave that off, because if Omicron had been our original variant, our death counts would have been so much higher. So we do have some thanks for that. Our ICU beds, we're at 7%. That's actually, so that means we have about, I'm trying to remember, we have about 3 or 4 left in amongst 4 hospitals. When I look at these when we look at Stratford County or the Seacoast region, I'm really looking at Frisbee, Wentworth, Portsmouth, and Exeter. I look at 4 hospitals, specifics to our greater region, so we're doing okay today, but we don't have a lot of room with this from a healthcare side in New Hampshire. We've been watching people over and over in other areas in other regions or of the country continue to do with this, and for some reason New Hampshire's always last. But who isn't last is our frontline healthcare workers. They're holding this thing up right now, and they've been underwater for some time. You think about Delta, when we really started hitting that surge, and our healthcare workers were already burnt out coming into it. That's they're really just kind of supporting our society right now. When Omicron was creeping up, the question was, how bad is it going to be? And if it's not that bad, do we really need to worry about anything, et cetera? And I thought Dr. Chu couldn't have said it better, which is, we already have National Guard in our hospitals, yet we're going to consider whether Omicron is mild or not. What's crisis anymore? What is crisis anymore? Because I don't think our general population understands the crisis that we're in versus the healthcare workers who are living it every single day. But we have some things that are changing. We have to understand things have changed. And one of those things is rapid antigen test and what that means, and the understanding that people have finally gotten to with those. There have been public health people advocating for over a year, some since the beginning of, I bet late spring, summer of 2020, saying we are not using the antigen test correctly. Don't care about them from a diagnostic perspective. PCR is not the gold standard, despite what we've all been told. And it depends on which lens you're looking at it from. If I'm looking at it from a diagnostic lens, then PCR is a good standard. But if we're looking at it from an infectious, who can transmit the virus and prevention of spreading the virus from a public health perspective, antigen tests are actually a better standard. And I'll walk through why. In 2020, our exposure times were this. So we'd be exposed on day 0, and then we may become infectious somewhere between day 3 and 5, 2 and 5, somewhere in there is when our infectious period would start, but our symptoms may not start until day 4 on average, and then beyond. So everyone was talking about that, pre-symptomatic spread. And we also have people who don't develop symptoms. We have asymptomatic spread. I'm not telling you anything you don't know right here. But then fast forward to 2022 with Omicron. Is just a faster developing variant. But the other thing is we're vaccinated. So with us being vaccinated, or some people have some natural immunity, even though immunity was Omicron was escaping natural immunity. What we discovered, what we have seen, is that our bodies are recognizing COVID-19. So it's doing what it's supposed to do. When you're getting a stuffed up nose, running nose, you're getting, stuffiness and headache, when you're getting a fever, all of those things are actually signs of your immune system doing that initial attack. So your immune system's doing the work. Those actually are good immunity signs. Bad immunity signs, bad symptoms are, diarrhea. Bad symptoms are difficulty breathing. Bad symptoms are brain fog, loss of taste, appetite. Loss of taste and smell, gastric emptying, vomiting, all those type things. Those are actually signs that our immunity is not working against the virus. So think about that from a symptom perspective of what you're seeing. But what we see is that on day 0, you're exposed, or maybe you even have symptoms on day 0. So much faster. You're becoming infectious within 1 to 3 days. And what the antigen tests are looking for is your infectiousness, your ability to transmit it from one person to another. This is kind of a complicated chart, but it's kind of where we are at the moment, which is if you get an antigen test and you haven't had symptoms for 0 to 5 days, the current under the current guidance is you can go and be out, mask up for 10 days. You could be in the general population. And if you're vaccinated, that's the general thing. If you're not vaccinated, or you're not up to date, which means you haven't been boosted, then you should be staying home if you've been a close contact for someone. That's the CDC guidance. New Hampshire's guidance is if you've been a household contact. Otherwise, if you're vaccinated and you're up to date, or if you're in New Hampshire and it's not a household contact, because I don't know, New Hampshire's different for some reason. I do know why New Hampshire did it initially, but the scenario's changed. It's not all about, Delta initially was really focusing in on a lot of household transmission that was occurring based on studies out of India, and that all changed over time. But if you're not vaccinated, not up to date, or, and you have that exposure in your home in New Hampshire, then really you should quarantine, right? You stay at home for 10 days or 5 days, and then in 5 days you can come out. I will tell you that pretty much across the board, most public health people will say, test at 5 days. Take an antigen test. And if you're negative, great, because you're probably not going to become transmissive after that. However, if you've had symptoms or you test positive at 5 days, continue to self-isolate and continue to try to test. The issue is we don't have a lot of antigen tests available yet. So my point to this is to say, as antigen tests become more available, please use them, take advantage of them. That 5-day mark is really critical, because there's nuances between day 0 through 5. And there's reasons why the antigen test may be negative, but it doesn't necessarily mean that it's a false negative. It just means that at that moment, that snapshot in time, it's negative. The other thing is, if you're going to use the home antigen test, take them in the morning, or if you're a shift worker, take them when you wake up. So give yourselves that extra 8 hours of sleep or 4 hours of sleep, however much you're getting, to have the ability to move forward with that infectiousness. So where are we going? I think that's a big question everybody asks. And here's kind of where we'll see is we're probably going to have a declining amount of COVID-19 as Omicron ends, as we come off of it. Hopefully we can have a relaxing spring. And then in the summertime, there's a good chance we're probably going to see some variant come out of some country. And, based on our population as vaccinated in the US, it's possible it could come out of the US. And then we'll probably see another surge go through the southern states. And then in the fall and winter, we'll end up back with another surge here. Now, what these surges look like may look different in a year. We certainly hope they do. Increase vaccinations in the US and globally, huge things, the biggest thing we can do long term. But also hopefully we can have some antivirals that we have a lot more access to that continue to work. Our monoclonal antibodies, certainly there's only one on the market left that even kind of can work against Omicron, but they'll develop new ones. We're going to get other ones out. So, technology and pharmaceuticals will continue to improve, but we need those to become accessible to everyone. Otherwise, we're just going to keep spinning in this cycle. What we can do in the short term, high quality masks, KN95s, N95s, KF94s, please, please, please upgrade your mask. They matter. Well-fitting as much as you can. And then try to stay in good ventilated places, air filtration. Look up a Corsi box, C-O-R-S-I, Corsi box. You can make them. And they're better than the commercial purifiers you can buy. So really, really invest and think about ventilation, whether you're in a home, an office, anywhere you are. We can't keep repeating this. We've got to get ourselves out of this cycle. 2023, I'm already ready for 2022 to be over. And think about the different things that we continue to have to say over and over and what's next. How are we doing? We're not really all doing that great, are we? So why is that? And this is true for everyone. It doesn't matter who you are. Our physical safety has been threatened. We are dealing with illness. We are dealing with death. We're dealing with concerns of long-term illness. We don't even talk about that half as much. I wish I had hours to talk to you about the implications of long COVID. People who are having mild symptoms that never go to the hospital, they're likely to have issues down the future. If you're under 18, it's been widely publicized, but you can't get into this enough, which is if you're under 18 and you contract COVID-19, you are twice as likely to develop type 2 diabetes. It's phenomenal. There's so many things about this virus. There are clotting disorders, so many things. We're seeing people 8-9 months down the road having clotting issues and dying, and they are not listed as COVID deaths because there's not that understanding yet, and we're developing that. So, political instability, it doesn't matter which side of the aisle you're on, it creates stress, it's tension. So the question is individual choice versus the greater good of health. Tensions over our own history, as we see a lot more, tensions as far as how we teach about race and different things in our past and slavery, supply chain issues, civil unrest that we've seen. So all of this creates stress. So when you have something and your mental health is affected by being physically threatened, your society's threatened, your values are threatened, people's housing is being threatened in different areas. Food at times have been threatened, transportation's threatened. Think about all of those things. I mean, my gosh, talk about going to, the hierarchy of needs. We're there. And this is why there's so much, we have all these things that are occurring that we're seeing in our communities: depression, anxiety, anger. We see a lot. I spend a lot of time moving, on just my personal situation I spent about last year, I think I spent about 120 nights in a hotel. And I spent a lot of time out in traveling, and the anger that I see of people is just never seen anything like it before. We'll talk about the PTSD symptoms a little bit: lack of appetite, overeating, drinking, substance misuse. These are all things you guys know. I don't have to tell you this. You know it already. It's just kind of a reminder that the pandemic is creating a lot of this, and it's getting lost in all these other things that people are trying to blame it on. We're really kind of, a lot of times when something bad happens, you're looking for something to blame, and a lot of times that blame goes somewhere that it shouldn't be. Long-term healthcare implications. This is what I really want you to think about, especially as we're having to help other people, especially as they move into substance use disorders that are going to occur. But the experienced people are leaving. History and knowledge, organizational knowledge and understanding is leaving the healthcare workforce. The new workers, some of them have already left and some of them are going to leave. Experienced workers who make it to the end, they're already dead. And this is the theme that I hear over and over and over, and I try to say it as many times as I can, is public health and healthcare workers are just simply dead inside. They're faking it until they make it. When it comes to empathy, when it comes to feeling, when it comes to all those things that they need to do. And thank goodness for them, but they are going to at some point suffer in the future. There's no way around that. The new workers who are excelling and continue, they may be fine for now. There's some, and I say that because there's some of us who are kind of freaks. We like this stuff. This is what we get into this for. Like, it drives us. But when you're new, that's okay. But after this is over, they are going to probably never have an experience like this again. Lack of fulfillment. They're going to, and eventually all of this will catch up to them, maybe 20 years down the road. So this is going to have very long-term implications on a healthcare workforce that we're going to have to deal with for probably the next generation. Who's suffering? This may have changed in the last 6 months. And I know I need to wrap it up. I don't know what's being said on my text message. Either A, I'm making a lot of people angry, or B, I'm pushing on time. And I'm almost there, I promise, Ashley. This was from a number of different studies that the CDC put out on the MMWR, weekly morbidity mortality report. And what it actually showed, and I was surprised, I thought the healthcare workers would have the worst mental health. And what it actually showed was that the public health workers had the worst mental health back in June. And this could have shifted in the last 6 months. I don't know. And the last thing I want to talk about is kind of, the PTSD, the suicidal ideations that we're seeing and the increases of that. I was talking to an epidemiologist one day, and I was like, I don't know how to put it into words other than the powerlessness of knowledge, knowing all of these things, knowing what we could be doing, knowing what we should be doing, and we're just not doing it, and then seeing all the death that occurs from it. It's so powerlessness. And that has led to different things, and everything here, I want you to know that if you're feeling any of this stuff, you are not alone. I have felt all of these. I have had, from previous work, I had some PTSD issues that, never quite go away, but you kind of work through and learn to live with. Those all increased drastically. I have never had suicidal ideations, and I have. So if you're feeling all these, I promise you, you are not alone. And there are a lot of people out there feeling the same things. And Ashley, if you can put that link into the chat that I had sent you, that's a specific for healthcare workers and practitioners, and that link basically leads to a it allows for you to get instant, constant communication with some people, but they also link you locally with mental health practitioners who are volunteering specifically for worst day. I promise you, someone else is having a worst day somewhere, and don't ever forget that. This was just a few weeks ago. Philadelphia, helicopter crashes off the rooftop of a hospital, and man, bless all of our healthcare workers, because this is what we do. We take care of human life, regardless of what's happening to us and around us. And there's nothing I think can be more symbolic than this flight paramedic or flight nurse, I forget which one that was, climbing out of this crashed helicopter. You can't even see the back ends, completely torn off, and with that infant in their arms. And it's just so heroic and impressive. But this is what people are doing every single day. They are putting their lives in harm's risk as they're trying to battle this, and have been for 2 years. That's all I have. Sorry if I went longer than I thought, but
that's okay.